video, we are going to discuss about fee schedule. As we discussed in the earlier classes, the insurance companies reimburse the providers based upon the CPT codes billed to them by the providers. Now, we know that the CPT codes indicate the level of complexity of the patient's visit based on the time spent by the doctor with the patient to evaluate the medical condition. Now, these reimbursements or payments are based on something called as provider fee schedule. Now, what is a fee schedule? A fee schedule is a complete listing of all the CPT codes and the corresponding fees used by Medicare to pay doctors or other providers or suppliers. Now, who decides the dollar value of a specific CPT code or how much payment a CPT code must receive? If you remember from our previous classes, CMS, which is Centers for Medicare and Medicaid Services, is the regulatory organization for healthcare in US. Since Medicare is a federal insurance, they will determine the provider fee schedule. If you look at the figure, this is how a typical fee schedule looks like. For explanation's sake, we have mentioned only few CPT codes, but the actual fee schedule will list out all the CPT codes ranging from 00100 to 99499 and the corresponding fees or allowed amounts. Majority of the insurance companies use Medicare fee schedule as a reference while reimbursing providers, which means that most of the commercial or private insurances also use Medicare fee schedule. Now, if you look at the above fee schedule, the first CPT is 99212, which is an established patient office visit. If you remember from our previous sessions, there are two types of patient office visits. The first one is a new patient office visit and the other one is an established patient office visit. Here, the level indicates the time spent by the doctor with the patient. So 99212 is a level 2 CPT code and $32 is the allowed amount for 99212, which means that no matter how much the provider bills the insurance company for CPT 99212, the maximum payment the provider will receive is only $32. In a similar way, for CPT 99213, the maximum allowed amount is $44. Now the next one is MAC, which is a Medicare Administrative Contractor. It is a private healthcare insurer that has been awarded a geographic jurisdiction to process Medicare Part A and Part B medical claims or durable medical equipment DME claims for Medicare fee-for-service beneficiaries. As you can see from the map, each of the 50 states is assigned to a different MAC. The MACs will regulate the fee schedule in the states which are under their jurisdiction. Now, there are millions of people in US who have Medicare coverage. And it will be very difficult for one single office with limited number of employees to process millions of claims across the country. So CMS outsources the processing of Medicare claims to private insurance companies known as MACs. Now, since these MACs are already established insurance companies, they will have the necessary infrastructure and resources to handle large volume of claims. For example, Novita's solution is the MAC for jurisdiction H, that is, all the states which are covered in blue color. In a similar way, all the Medicare claims in jurisdiction F are processed by Noridian. And in jurisdiction J, they are processed by Cahaba, and jurisdiction M, the claims are processed by Palmetto. Now all these are private companies. The reimbursement or payment structure followed by the insurance companies is based on the allowed amounts which are mentioned in the fee schedule. So what is an allowable charge? Sometimes known as the allowed amount, maximum allowable, or usual customary and reasonable UCR charge. So this is the dollar amount considered by a health insurance company to be reasonable charge for the medical services or supplies billed by the provider indicated by CPTs and based on the rates in that area indicated by the fee schedule. Now, when setting up the doctor's practice in the billing software, based upon the state in which the provider is located, the billing office is going to download the fee schedule from that corresponding MAC website. Let us assume the provider's office is located in the state of Texas. Then the fee schedule will be downloaded from Novita's website. Or if the doctor's office is located in the state of Arizona, which falls under jurisdiction F, which is handled by Noridian, then the fee schedule will be downloaded from the Noridian website. Usually there is a slight variation in the allowed amounts from one MAC to another. Now the next one is billed amount or charge amount. This is the dollar amount that the provider bills to the insurance company for a specific CPT code. It is usually 1.5 times to 2 times of the actual allowed amount or charge amount. Now it's a general practice for the providers to bill insurance companies 1.5 times to 2 times of the actual allowed amount. Now let us take the example of 99212. As per the fee schedule, the allowed amount is $32. But when we bill insurance company, we are going to bill it with $48, which is 1.5 times of $32. Now this concept applies for all the CPT codes. Now the billing office will coordinate with the practice management software team and upload the modified fee schedule in the billing software so that whenever the charge entry team enters a CPT, it will auto-populate the billed amount, which is 1.5 times of the actual fee schedule amount. Now, once the claim reaches the insurance company, claim payment will be done as per the fee schedule, which allows only $32 for CPT 99212. So always remember, no matter how much dollar amount the provider bills the insurance company will pay the provider only the allowed amount as per the fee schedule. and all the excess amount must be adjusted by the provider. Now the next one is insurance write-off or provider adjustment. The difference between the billed amount and the allowed amount is known as provider adjustment. And as per the provider contract with the insurance company, this difference amount cannot be billed to the patient. Now, since this amount is adjusted by the provider, it is known as provider adjustment. As you can see from the above example, we have billed insurance company $48 towards CPT 99212, which is 1.5 times of the actual allowed amount. Now once the claim reaches the insurance company, the insurance software is going to process the claim as per the fee schedule. Now there will be an excess amount remaining that needs to be adjusted by the provider and cannot be billed to the patient, known as provider adjustment. Now, in order to understand it in a better way, once the claim reaches the insurance company software splits the billed amount into insurance payment and patient responsibility. Provider adjustment. Now, again, the allowed amount is split into insurance payment and patient responsibility. So, billed amount is the dollar amount provider bills to the insurance company, which is 1.5 times to 2 times of the allowed amount as per the fee schedule. Allowed amount is the dollar amount insurance company allows for a specific CPT code. Patient cost share is either copay plus deductible or co-insurance plus deductible. It is also known as patient responsibility. Now again, let us take the example of 99212 and let us assume that the patient's insurance plan has a copay of $10, and as per fee schedule the allowed amount is $32. So the billed amount is going to be 1.5 times of $32, which is $48. Now the insurance company is going to split that $48 or billed amount into allowed amount and provider adjustment. Now we already know that the allowed amount is $32. So there will be an excess amount of $16 which will be considered as provider adjustment. Now again, this allowed amount consists of two components. The first one is insurance payment and the other one is patient responsibility. In this example, the patient responsibility is $10 towards the copay. So that leaves us with $22, which is what the insurance is going to pay the provider. So allowed amount is billed amount minus adjustment amount. Now, whenever there is an adjustment on the claim, the insurance company will mention the reason for the adjustment through CARC, which is Claim Adjustment Reason Code. These codes describe why a claim or service line was paid differently than billed. Now the next one is RARC, which is Remittance Adjustment Reason Code. These codes are used to provide additional explanation for an adjustment already described by a CARC.